It is widely recognised that people with disabilities are amongst the poorest and the most vulnerable in developing countries. We know that poverty is both a cause and a consequence of disability. To achieve the targets set for the Millennium Development Goals and to alleviate poverty, people with a disability must be actively included in development activities and processes.
In my experience as a writer, when I travel to some of the poorest countries, inclusion in reality is still a long way off for people with disabilities.
The MDGs really need to address the issue of disability. If we ignore people with disabilities, then we're not really going to be able to, I think, adequately meet the goals of the MDGs and what we're trying to achieve.
Everyone agrees that Millennium Development Goals are important, and this is what we should be striving for.
I actually come from a developing country. I was born in El Salvador in Latin America. I have seen poverty firsthand. I have seen the difficulties people with disabilities have. It's not available for them, where governments don't have any budget for them, and when the resources that they have are very limited, they actually have to rely on relatives. They have to beg on the streets to be able to be fed.
The key to get out of the circle of poverty is education. However, 90% of children with disability in developing countries are not in school.
We see a lot of children who are disadvantaged because of their poverty and their circumstances. With the opportunity to advance in their education or receive universal primary education, we really believe that it will sincerely make a difference to their lives.
Women and girls with disabilities face multiple disadvantages. For one, they're women. Two, they have a disability and predominantly live in developing countries. They have limited access to reproductive health and also greater risk of violence and abuse.
11 million children under the age of 5 die every year, and that means it's roughly 1,200 children per hour that die from preventable disease and illness. Every 30 seconds a child dies due to malaria, and malaria is also a huge cause for all sorts of disability. Quite often access to medication, to mosquito nets, those sorts of treatments or prevention is really only accessible to people who have a bit of money, and the poorest of the poor are those that are most at risk, really.
Millions of women in the developing countries are affected by fistula and now have a disability. But the good news is, this disease is preventable.
It's really important to reach out to people with disabilities and make sure that they actually receive information on such diseases, because often people such as myself with a vision impairment or people with other disabilities actually miss out on getting any of the literature that informs them about how to protect themselves and how to be safe and free of disease.
People with disabilities are particularly vulnerable to climate change. Because they're often the poorest of the poor, they end up living in the most marginal places, and that means they'll be the most affected by rising sea levels, tsunamis, wild storms, and they're probably the least able to move to a safer place.
The members of the Australian Disability and Development Consortium, together with their partners, are working to ensure that all MDGs are met. In this action alone, they are addressing MDG 8 to develop a global partnership. A partnership implies inclusion, which means everyone. I invite you to reflect on how you can make a difference.